help them look forward to what they might do in the planning of the organ transplant system to best fulfill the needs of the people of Ontario. And we think that if we do that, we'll be able to make some difference going on in the future, which we hope will accelerate into future years. So if people are looking for how to engage, and helps us help our other citizens when they're in time of need. Thank you very much.
With many different diseases that are waiting for many organs. And awareness is one of the key issues. And hopefully this task force, if I may use that term, will address what is going through the minds of Ontarians as far as how they are coming to their decisions or lack thereof in this province. The Trillium Gift of Life Network has worked very hard to raise awareness with their celebrity campaign and also raising awareness in Ontario's hospitals. Driver's License Bureau.
And I'm the guy that's been in the trenches. I'm the guy who's been at the forefront. I'm the guy who's been challenging the government left and right. Is my name mentioned there once? No. You didn't hear Step by Step mentioned there once. You know, why? Why don't we ask the minister why my name wasn't mentioned there? Why wasn't Step by Step mentioned there? And what's going to happen with this committee? I hit this point. We're going to have 40 consultants, you know. From 1999 to 2006, we talked to hundreds of thousands of people in Ontario. We've already done the research. What's all this about? You know? They should have been making some movement on the opt-out, how every hospital was going to incorporate heart debt donations, how we were going to look at possibly a national mandate in the provincial delivery system, how we were going to allocate millions of dollars for live donors. I didn't hear none of that. You know, I heard some window dressing here today, you know, and I'm not upset just because my name wasn't mentioned Step by Step, because I've been hearing the same bullshit for the last 8 years, and I'm tired of it, and so is Canadians, and especially the ones that are on the waiting list. So am I upset? Yes, I am. I'm upset because I wake up every morning thinking about what that person that's clinging on to life, what they're feeling, and I got to hear more bullshit there. You know, this was supposed to be an announcement. Where's the announcement? I don't see no announcement. I see window dressing.
Why do you think that they're just announcing another thing?
To make it look good. A Liberal election's coming up. They got to say that they're doing something for organ donations. It's been in the forefront. I think that was acknowledged. Finally, this issue's getting some profile that it's supposed to. You know, so from way back in 1999, why haven't we done better? Why has the ball been moved from the scrimmage line a few yards? We're not even close to where, you know, so what's this going to do? You know, like I didn't hear anything about it. I've been involved in this for the last 8 years. I know what's going on with this. I didn't hear any positive steps here. And like I said, if Smitherman doesn't like that, I don't care. I said the same thing to Harris when he wasn't making any movement. I said the same thing to Chrétien when he wasn't moving on the national mandate, and I'll keep saying the same thing. I don't care.
In our province. I'd also like to recognize and welcome Mr. Frank Markle, President and CEO of Trillium Gift of Life. Welcome, Frank. The severe shortage of organs and tissues in Canada is a pressing issue that's receiving much needed attention here today. Today, approximately 1,800 fellow Ontarians are waiting for life-saving organ transplantation on our waiting lists. There are patients, there are family members, our friends, there are colleagues. Every one of us, healthcare providers, members of government, and community agencies has an important role to play in giving hope to patients in need of a new organ. As the largest multi-organ transplant program in Canada, the University Health Network works closely with the government and with Trillium to provide patient-centered care for our patients in need of transplant. Each year at this hospital, we perform approximately 350 organ transplantations, including heart, liver, kidney pancreas, lung, as well as living kidney and living liver donor transplantation. Earlier this year, we performed Canada's first anonymous living liver donation. We also this year completed an innovative kidney swap with 2 patients along with our colleagues at St. Michael's Hospital, and have held a very successful symposium under Dr. Gary Levy's leadership, bringing experts from around North America in transplants together to help us to develop strategies to increase awareness about organ donation in this province. One of the things that I've learned personally as I've come to learn more about our organ transplantation program as CEO is the excellent outcomes achieved by our patients once they obtain a donor organ. Pointing out the excellent outcomes that our patients have, in a few weeks, our own Heather Ross, Medical Director of the Cardiac Transplant Program at the Peter Munk Cardiac Center, and a very brave heart transplant recipient named Gail Shepman will be doing their part to promote organ donation awareness and demonstrate the terrific outcome that organ transplant patients have. Minister, they're actually climbing Mount Vincent Massive, the highest peak in Antarctica, at almost 5,000 meters. This is a remarkable journey, one that we'll be following closely and proudly as Heather and her patient climb the highest mountain in Antarctica. Without further ado, I'd like to turn the microphone over to our Minister of Health, who certainly is a champion of organ donation and has spent so much time and effort as a champion of this cause, the Honourable George Smitherman, Minister of Health and Long-Term Care and Deputy Premier of Ontario, for today's announcement. Welcome to University Health Network.
Mesdames et Messieurs, it's a privilege to be here at the University Health Network Toronto General Hospital, and I want to welcome everybody to my riding of Toronto Centre Rosedale. The task at hand is that not every Ontarian has to date been able to gain the tremendous advantage that Kitty's going to tell us a bit more about. We're all here really today for the 1,781 patients in the province of Ontario who wait patiently in very, very challenging circumstances for the gift of life. We've all worked hard and we've made improvements, but the reality is there is more work to be done. I'm really, really glad today to be able to welcome and introduce to you my colleague from the Ontario Legislature, Peter Cormos. Peter stands as one example of a member of the legislature. They're all very dedicated, but not all of them have challenged us with private members' bills. Several have. What we seek to be able to do today is move forward to give a broader opportunity to Ontarians, and through this panel that I'll introduce appropriately in a moment, to be able to give more people an opportunity to be involved in a conversation. Some people use the word consultation. I prefer the word conversation. It seems to me that the opportunities to enhance organ donation are quite clear, and some of the strategies that people might move forward with are quite acceptable to some, but perhaps not to all. Accordingly, we think it's very, very appropriate that we give people an opportunity to let their views be known, that we give people an opportunity to engage the debate, participate if they wish, or at least to be able to take advantage of all of the information that is available. Accordingly, it's my privilege today to be able to announce and to introduce to you the Citizens Panel on Increasing Organ Donations. Now, we've reached out, there are so many people, of course, that could be of tremendous assistance in moving this forward. We think that we've done a good job of finding 6 exemplary Ontarians who have a tremendous capacity and a willingness to work hard over a fairly short period of time to bring back advice to the government in the forms of a plan that would allow us to move forward with a view toward enhancing organ donation and, of course, the opportunities therefore for transplant. It's a privilege for me to be able to introduce these individuals to you, leading off with Dr. Ted Bodway, who will be our chair. He's the executive, he's recently retired from the Ontario Medical Association, where he played a role over a fairly long period of time in an impressive way. Associated with TED are numerous public policy enhancements that have contributed significantly to the life of many, many Ontarians, and we're very, very fortunate to have his leadership. He's going to be well supported. I want to introduce 5 people that will work alongside him. First, I want to introduce Reverend Dr. Brent Hawkes. Now, Brent Hawkes is well known as a human rights activist and as the leader of the Metropolitan Community Church. But what I know about Brent Hawkes is that he has a capability that not everyone has, and that is to bring people people from a wide variety of perspectives together and to engage in conversations, even if they are about very, very difficult subject matters. He's going to be assisted by a woman that I've had the privilege of knowing for a long time. She served the Canadian Senate and the people of Canada with extraordinary distinction, and that is Joan Neiman. We're very, very privileged that she's willing to join us. Working alongside Ms. Giselle Lalonde. Some people refer to her often as the former mayor of Vanier. Many other people will know her as a leader from the Francophone community in the province of Ontario that fought very, very vigorously for the Montfort Hospital. The passion and dedication that she brought to that task is why we really felt that she would be so appropriate to take on the challenging work associated with the issue of enhancing organ donation in our province. Two additional members, Mr. Peter Deborah. He's very, very well known for a wide variety of roles. Of course, was someone that spent a lot of time in our living room over a period of time. A well-known print and television journalist. He's been so involved in helping to educate and stream subsequent journalists and to help to work through the challenging circumstances of reporting on subjects, including the kind that is before us. And last but certainly not least is recently Canada's ambassador to the Dominion Republic, and for a lengthy period of time in service to the people of Ontario as a member of the Ontario Legislature and as its Speaker and as a Cabinet Minister, Alvin Curling rounds out this panel of 6 people. The challenge that we have is to take a look at the steps that government could take to increase awareness about the importance of organ donation, how to remove barriers to organ donation, how government can appropriately support and encourage more living organ donations, and the best ways for people to make their donation preference known, registered, and recorded. I said a moment ago that we're motivated collectively by the fact that 1,781 people, to the very best of my knowledge, that's the current number, wait today on a waiting list. We want that waiting list to be associated with hope. We don't like the idea, of course, that anybody on a waiting list would feel like they are languishing. But we know, of course, that in order to be able to move these lists forward, we have great hospitals and great clinical capability to do so, but the organs themselves are pretty essential in the task at hand. We've made some progress in Ontario, and what we ask these individuals to do in short order is give us an action plan that will give us the capability to build on that progress. We think that momentum is fantastic, and accordingly, we wish to accelerate that momentum with some good advice offered in short order from these individuals. Just a couple of things in the last year or two that I think are have been hallmarks of the good work of the Trillium Gift of Life, which are very, very worth noting. We've been working as an example to increase organ donations.
Record.